Thank you. Before I get started, I want to talk a little bit about the culture of this room. The members of the committee have done a remarkable job keeping us on task and keeping speakers. But there's some other people behind this, Ms. Cox, Ms. Schern, and then Carrie is running the sound back there that's actually going out to more than probably a dozen people who are sitting at their office watching us. And Patrick is doing the job of getting the right side of me over here. Patrick, thank you very much. So I wonder if you join with me in thanking Adrian. So I am the seventh of 39 speakers who is Y chromosome impaired. But my research is in actually why women are better leaders than men in complex settings. And one of the things that I'm not sure that we quite have the stomach to say is this. Yesterday we heard a really, well, it was a moment when someone said, I'm having a heck of a time selling the future of nursing. Well, I don't know if it's misogyny. I don't know exactly what the issue is. I mean, nursing 5 years ago was the largest profession in the United States. Nursing today is the largest profession in the United States. But it occurs to me that maybe it has to do with the terror of having the people who actually could do a better job in a complex setting do that job. So I'm going to ask you to do something that I know this culture can tolerate, because yesterday, right before lunch, what did we do? We talked about statistics and data, and everybody stayed awake. So here's what I'm going to ask you to do. Close your eyes just for a second. Picture yourself at the first dance that you ever went to, either in middle school or junior high, okay? See yourself on that dance floor, and see yourself walking across the way to ask that person that you've most wanted to dance with to dance. Okay, now open your eyes. How many of you were able to visualize that? Anybody? Okay, that's because it was a huge risk, wasn't it? Let me walk through what it is in organizational science that we call risks. The more people in organizational entities are affected, the greater the risk. The deeper the impact on the organizational culture, structure, policies, strategies, processes, and leadership, the greater the risk. The less adaptable the change initiative is to the environment, the greater the risk. The more intensely stakeholders perceive their potential loss, the greater the risk. The more diverse the organizational viewpoints and perspectives are, the greater the risk. The more rigid the regulatory constraints are, the greater the risk. The more vulnerable the funding is, the greater the risk. The greater the public interest in the change is, the lower the risk. Now, I think that's fascinating. Now, if you think back to that junior high school dance, all of those things came into play. The stakeholders, you know, what if I fall in love? What if we get married? What if we have children? Where will we live? But let me walk you through a couple things that are happening in this larger environment. I want you to close your eyes, get up again. You don't have to close your eyes this time. Get up again and think about what it is that the future of nursing is asking people to do in the context of today's environment. 5 years ago, student debt, average student debt, $25,000. This year, $35,000. There were 4 states that had practice discussions underway. Today, there are 16. 83 organizations with registered lobbyists in the field of nursing in Washington, D.C. 5 years ago, 96 today. In 2010, we went through this process called redistricting in the states. Today, because we've looked at the 2012 and 2014 elections, what we know is the state houses are more bifurcated, more red and more blue, and less purple than ever before in the history of our country. And so some of the things that we're asking state legislatures to do is to create extraordinary change that is perceived as extraordinary risk. I love the notion that data and EMR are somehow helpful. In my discussions with practitioners of all venues, what they tell me is it's designed for reimbursement. It's not designed for quality of care and patient care. And it's designed by the finance organizations. In fact, one organization in Philadelphia, I interviewed a bunch of doctors about what was happening with their careers. Why weren't they progressing? And they said, it's because I see patients all day and then I go home and I fill out electronic medical records by midnight in order that we might be able to bill for the next day. When we look at this population and the syndemics of the population, mean, we're talking about diversity, but what we also know is there's this huge herd of people with Medicare that are moving into the system. And in fact, the fastest growing population in the United States is those who reached 100 and are growing. 5 years from now, there will be 10 million more people over the age of 65 than there are today. And you know, the average person of the age of 70 is seeing 5 specialists. And so you know who their care coordinator is? The pharmacist at CVS, the pharmacist at Walgreens, the pharmacist at Walmart. In fact, in low-income communities, the most trusted provider is the pharmacist, outstripping the nurses, only in low-income neighborhoods. The ACA provides everybody access to insurance. Let's be clear on that point. It doesn't provide them access to care. It provides them access to insurance, which is a financial instrument that does not acknowledge differences in what is synergy of collaborative work. Since this meeting began yesterday morning, the term leadership has been used 165 times. Okay, and we had only one definition that was on a slide up there. But we used it 165 times. One of the things that my research shows is that men, okay, those of us that are men, we have a transactional model for how we use leadership. Women use a transformational model. So what I'm suggesting to you is that yesterday, if future of the nursing is a problem, 15 years ago today, Clayton Christensen wrote the article that one could actually buy in something called a magazine. And you could get it at a bookstore or a magazine store. And it said, will disruptive innovation cure healthcare? I would argue the future of disruptive nursing is what you guys ought to change the title to. Because if you adopt the things that are proposed, it will be the disruptive innovation that will cure healthcare. Thanks.